Well, good afternoon, everyone. My name is Gretchen Heckenlively. I am the lead of our healthcare regulatory department here at Eide Bailly. Our primary focus is on preparation of Medicare enrollments for organizations and practitioners. But along with that, also, of course, is going to come licensure, provider-based, and other regulatory requirements. So one of the big questions that we get a lot is, where should provider enrollment be housed? Should it be in finance? Does it belong in compliance? I always say legal should really be involved in this process. Sometimes we see it with patient financial services. Sometimes it's in the revenue cycle. The answer is there really is no right or wrong answer on where provider enrollment should be housed. A lot of it depends on the organization, but if it's done right, honestly, it should be touching all of these areas, and you should be working together on these filings. In some cases, we're asked to come into an organization to assess their provider enrollment functions. And what we find many times is that we end up introducing departments to one another because they are siloed in their approach. And if I go back to our title slide, there is our silo, and that might be how you feel as you're working between different departments. The reason that we end up introducing the departments to each other is because many times they all share similar information needed to complete the required filings. But a lot of times we find that information doesn't match. In other situations, we find that different people are handling the same functions, maybe on a regional level, and we determine that they're not preparing the enrollments consistently, even though they're under the same organizational structure. And obviously that can cause some potential compliance issues. Today, I'm happy to be joined by two wonderful organizations who have taken tremendous strides to centralize portions of their facilities and to help streamline their enrollment work to reduce denials and increase compliance. We are very excited to provide them a platform to share their stories, including the obstacles they've all incurred along the way, all the way to the triumphs they've experienced, in an effort to help others that may be going through the same situations or have been tasked by management with taking on additional roles and responsibilities in these areas.